Hello and welcome to today's webinar, From Compliance to Competitive Advantage, Transforming Network Management with AI. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded, and an online archive of today's event will be available within 1 to 2 business days. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen on a PC or Command R if you're using a Mac. And you may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today Amit Garg, CEO at High Labs, and Amy Acker, Vice President of Network and Provider Operations at Communicare Advantage and West Virginia Senior Advantage. And at this time, I'd like to turn the floor over to Tiffany Kahn, Network Product Expert, who will be moderating this webinar.
Thank you so much. Welcome everyone to today's webinar, From Compliance to Competitive Advantage. In today's webinar, I'll be discussing how in an ever-changing regulatory landscape, health insurance plans must really adopt smarter approaches in network management across network optimization, compliance, and competitive advantage. And so we'll be really exploring how AI-driven and real-time solutions are helping payers move from reactive compliance to intelligent and enterprise-wide network design. Here today we have Amit Garg. Amit Garg brings truly an extensive experience in business development, product development, operations, consulting, and financial analysis. And he's really successfully led 2 startups from inception to acquisition, really demonstrating expertise in scaling and strategic growth. And also he's been very focused across the board in providing payers, providers, and patients with access to clean, timely, and actionable data. And additionally, we also have Amy, who is our VP of Network and Provider Operations at Communicare Advantage. To get here, she brings 20 years of experience in the healthcare payer and provider operations space. She's held leadership roles at Molina Healthcare, Innova, and the National Spine and Pain Centers, bringing a very unique experience on both the payer and the provider side. And as well as she specializes in Medicare Advantage, credentialing, network development, and as well as provider operations across the board. So really excited to have both of these 2 today to really discuss overall what does traditional network management look like, and as well as where AI can really play a role in this space. And so now I'll be handing it off to Amy, who will be discussing what the traditional state of network management has, what are the challenges and pressures that she's experienced from both the payer as well as the provider perspective.
Thank you, Tiffany. Appreciate it. Just to recap, I've about lawyer by trade, 20 plus years working in the managed care and network development environment, both on the provider side and the payer side. I led Anthem's MMP, Medicare Medicaid demonstration project in Virginia, worked as a COO for Molina. I was a VP of managed care at Innova Health System, which is a regional health system in Northern Virginia with the full continuum of care. And I was responsible for doing all their managed care contracting as well as credentialing. And I'm currently with Communicare Advantage and West Virginia Senior Advantage, 2 separate Medicare Advantage plans, both owned by the same organization. It's provider-owned institutional special needs plans. One of the challenges throughout my career that I've faced, both from the provider side and the payer side, is provider data. As you all probably know, it is an awful lot of information to keep accurate, to get submitted to health plans, submit it in a way that they can consume it, and then for the health plans to be able to consume the data and maintain the data. So I was running some numbers just to give you an idea about what I'm currently facing. And with the number of unique NPI numbers we have, which is close to 50,000 throughout our 2 networks, and the 11 pieces of information that I have to submit on an HSD table, that's over 553,000 pieces of information that I have to have accurate at any given time. And that's not counting the fact that most of our providers have multiple practice locations. So you can see that it could very well be over 1 million pieces of data points that I have to keep accurate, not only for CMS compliance purposes, but also for claims payment purposes, for provider directory, so our members can find providers that they can see. So it's really important that we partnered with High Labs so that we could get the most accurate data that's available to serve our members and our providers well. As you know, every payer has different formats that they want their rosters submitted in, and every provider doesn't want to have multiple roster types. So a big challenge for us is that providers will send us whatever format they want, and we then have to manually work to get it into a format where our TPA, our third-party administrator, can actually load it and use it for us. Significant amount of manual work right now. Downstream implications for us as a health plan, again, is network adequacy, network analysis, network build, provider lookup tools, claims processing, and provider directory development. It also, for me, drives a lot of our growth and business opportunities. Having accurate provider data tells me, where do I have adequacy in the counties? Which counties can I expand into? Where are those market opportunities for us to grow as a health plan? And who are the right provider partners to do that with? With our partnership with High Labs, this past year, we were able to add 3 additional counties in Maryland and 8 additional counties in West Virginia. Very exciting. Now we're looking and poising to what are we going to do for 2027? I'm already looking at 2027, so that's exciting. The other piece that we found has been very helpful is with our provider directory accuracy. We audit ourselves. And in the past, my team would do random audits, just randomly pick a provider, call, and find out, are they still at this location? What are their office hours? All of the things, right? To make sure that our information was correct. With High Labs, we're able to actually pinpoint, they make recommendations. These are the ones that we know are right. These are green. These are good to go. But here's the yellows and here's the reds. Focus on your reds. And so it's been able to drive my team towards really focusing on those providers where we might have a problem and allow us to manage those over 500,000 points of information a little bit more accurately. Thank you.
And Amy, would you mind going into a little bit more detail in terms of how you've been truly tackling a lot of the provider data quality issues, especially in the ever-evolving CMS requirements? For instance, there's a lot more complexity now, there's more scrutiny, especially with behavioral health. Would you mind going into a little bit more detail in terms of what have your experiences been there?
Yes, we find that there's a lot of information that's inaccurate even when you're going out to look at Google, right? Even looking at other competitors' provider directories, pulling data from multiple different sources manually is very challenging. And a lot of that information isn't even up to date on public websites. And so getting the information from High Labs has allowed us to really focus, because you're pulling it from multiple locations, so I don't have to. And that frees up my time to actually do the legwork to make sure that the information is accurate in our systems, that it's getting consumed by the TPA correctly, and then fed out into our information, whether that is an HSD table, whether that's a directory, whether it's claims processing. It really helps us focus on the true inaccuracies that we need to fix.
Amazing, Amy. And also, when we think about provider data as a whole, what has been your experiences at CommuniCare / West Virginia Senior Advantage versus, say, a larger payer at like a Molina or Anthem as well? What are the key differences have you seen?
Oh, well, the biggest difference is we're small. We only have about 4,000 members, but we still have to do everything that the big plans do. The big plans have lots of hands that can help them. We don't. We're just a smaller organization. So all of the things that a Humana or a United has to do, or an Anthem or a Molina, we still have to do ourselves. So getting a very accurate picture of where we need to focus is really important, because I don't have 100 people behind me helping me do this. That's probably the biggest difference.
Perfect. And so now, that Amy has given sort of the state of what traditional network management has really looked like, all of the challenges across the board, would really love for you to fill in here in terms of what have you seen from the technical side of things? How have you seen traditional network management fall short?
Sure. Thanks, Tiffany. First of all, thank you everyone for inviting me to this webinar. And um, to discuss this important subject around how do we um, create smarter networks using technology. And it's an honor to share the panel with you, Amy. And thank you so much for your kind words about High Labs. The partnership has been great with your organization. Now, how AI and technology can help in building smarter networks? I'll break that into three pieces, right? One, what is the problem we are trying to solve? Two, what is the foundation for the foundation that we need to build before AI can do something meaningful, or with the help of AI we can do something meaningful. And the third piece would be how we can take help from AI and solve this problem, and why now is the right time. What has happened recently that now AI can help in solving this problem. So let's start with the problem. So I think the problem is traditional network management falls short. And why do I say that? I think we have been looking at network management primarily from the compliance perspective, which in my mind is one of the five lenses that we should utilize when we look at this problem. Right? Similar to in the business world, we have these Porter five forces. Similar to that, I would say there are these five lenses by which we should look at holistically managing our networks. And compliance is one of those lenses and very important. What are the other four lenses? One, and I think Amy, you touched on that, accurate data. How can you create effective network if you have those ghost networks in your data, right? So access to accurate information around providers is very important for anything that you do in network management. The other lens would be cost efficiency, right? When you're looking at the providers, um, how do providers compare with each other, or how do a provider and peer combination compare with each other for specific type of procedures, right? We should look at the cost efficiency part lens as well when we look at network management. Then quality of care, um, and quality of care can mean different for different people, right? So a provider might be a 5 out of 5 um, quality provider for patient A, but might not be 5 out of 5 for patient B because of variety of factors, right? And then the fifth lens, which in my mind is the most important one, which is a member. Right? How do we look at network management from the lens of a member profile, and then if we broaden that, the profile of the cohort of members, right? So the whole population health management aspect has to be part of an effective network management strategy. So that's the first piece, that what exactly is the problem statement, and which, just to reiterate, we are looking at only from one lens. We should look at from all of these five lenses. The second piece is, what's the foundation of coming up with a solution? And again, I will reiterate, clean provider data. That is the foundation. No AI or no technology can solve the problem if you do not have clean provider data. I mean, imagine you're expanding your network um, using data with errors. Um, Determining that TIN or NPI address relationships with faulty data. So the foundation of any effective network management is based on clean data. Now, the third piece is that how now we can use AI to come up with uh, uh, the right approach uh, to create smarter networks. And again, I'll take those 5 lenses approach and how AI can help from all those 5 lenses. Number one, accurate data. So AI now is able to scan through like massive amount of data with lightning speed. And the other part is with generative AI, AI is now also able to like humans. Right? So as Amy mentioned, AI can look at every possible source of data for a doctor. And you can look at external sources. You can look at um, data sources from government. You can look at health plans internal data set, like for example claims, the provider contract, and EMR data if that's accessible. All of that need to be looked at with the use of technology that can reason and that can scan through massive amount of data with lightning speed to come back with the right information about the provider. So that's the accuracy piece. Now on the compliance side, um, even though compliance at the end of the day is about looking at variety of um, compliance rules on the federal side, on the state side, but all of that should be externalized, right? Those rules should not be buried somewhere in a software code. It should be externalized so that policymakers, subject matter experts can manage those compliance rules, and with the help of AI and predictive modeling, should be able to with a click do some sort of impact analysis, right? Um, so technology can play a big role even on the compliance part um, if we have the right set of technology that is um, combined with predictive modeling over there. Then the third piece is cost efficiency. Now we have massive amount of data available in terms of, for example, price transparency data. Um, Totally understand that that data is complex. It's large amount of data, but again, with the right set of tools, AI can scan through those data sets to come up with the right patterns and understand those patterns to understand the cost efficiency part um, uh, when it comes to the specific procedures for the payers and providers. Then the quality piece, provider, as I said earlier, that the quality of care can be subjective depending on the geography of the patient and the provider, depending on maybe there might be some sort of a language barrier between the parent, between the provider and the patient. So provider can be a provider can be, as I said, five out of five for a certain patient, but might not be five out of five for other patient. So the fifth length, which is the member profiling, that's in our mind is the key for creating effective networks, and AI can play a big role by looking at the entire ecosystem around a member. Demographic information, member, longitudinal view of the member disease profile, then can look at the socioeconomic factors around the member. And then based on that, and then expanding that to the cohort of members, and based on those cohort of members, whether it's 4,000 members or it is 40 million member population, those cohorts approach of looking at those member profile, and then curating a network that is most effective for that member profile um, is, I would say, the new way of creating networks and managing your networks. Um, so um, that's how we are looking at network management in this new world of AI. And again, the AI has to, we make sure that we have all the checks and balances to make sure that we are validating what AI comes back with in terms of insights before we operationalize AI-driven solution to solve these problems. Thank you, Tiffany.
Thank you so much. Thank you so much, Amit. And so when we think about overall, we have some questions from the audience, as well as would love to discuss a few different topics with both you, Amy, as well as Amit. A couple of things. So how you both mentioned that AI has really changed a lot of the way that network management has occurred. For instance, being able to do provider recruitment prioritization, supporting your efforts in building narrow and wide networks needed. How can AI shift the team's role from being reactive to strategic? And ultimately, what does the future look like? And we'll start with Amy first.
So for us, it's really shifted how we look at our work. So rather, prior to this, you were really doing manual searches to find targets of providers that would help you close your gaps. You were doing a lot of outreach, and you don't necessarily know that would actually close a gap in that particular zip code. Now we can actually look at things and see what providers actually exist, what are their specialties, where are they located, and will they actually close that gap in that particular zip code. We can look at who might be the right partner for us overall. It doesn't make sense for us to look at individual groups, or does it make sense for us to target a larger medical group practice maybe associated with a health system because it's going to close multiple gaps. That allows us to spend our time and resources in a much smarter way to get the right network for our members. And to Amit's point, we also have to look at who our members are receiving services from. That helps us also identify where we need to develop our network to support our members and our providers in their referral patterns. So my team works smarter, not harder, but smarter for sure.
For sure. And for instance, when it comes to doing strategic thinking in the network planning side of things, how has your team really shifted towards building like narrow networks versus wide networks in the advent of a lot of the cost-cutting strategies that are occurring in today's environment?
So what we're doing, what I look at from growth perspective is what counties, because we're very specific as an I-SNP, all of our members live or are expected to live more than 90 days in a nursing facility. And so we have some very specific, but we're held to all the CMS standards like any other MAPD plan. So we have to solve for the entire county. I look to see where do we have buildings that we're not currently selling in. What do those counties look like from a network adequacy perspective? Can we obtain network adequacy in an efficient manner without having to contract at enhanced rates, where we can have cost competitive business and not pass additional cost onto our members in terms of cost share? So I look at those opportunities where it might make sense, where there's eligibles, where there's buildings, and where there's a good provider base. And sometimes that's a lot more challenging than others. There are counties in Indiana where we could have an opportunity, but there's not enough just not enough providers. So the lift doesn't make sense. So we focus where we think we can really have a growth opportunity. And like I said earlier, we're already looking at 2027 because we have to file our network in February of 26 for 1/1/27 go live. So a lot of advanced planning, but the information and the accuracy of the information really helps drive those decisions for us.
And Amit, what you have seen, how has AI really shifted the team, I would say, network management overall from reactive to strategic? And as well as we have a question from the audience of whether or not do you see the impact being traditional AI versus agentic AI as well?
Sure. Great question. One thing I would say is, as Amy mentioned, that when you are building your network or you are just managing your network, it's important to see what's the actual information about the provider, right? Otherwise, if you add another provider with a ghost location, you might be thinking that you are enriching your network, but actually you are enriching your ghost network, and nobody wants that, right? Um, and in AI, as I said, we have to holistically look at this problem, where AI can help from all different angles. So, for example, provider contracting, right? There's a lot of information, um, where I would say AI can help even in that early step of contracting, where you look at across all different contracts. And generative AI is today can enable us to look at all different type of contracts, look at the historical patterns, of payments, um, to even make sure that the contracts that the payers sign with providers, they are consistent, right? So starting from the right quality of data from your contracting to, once you add the providers to your network, making sure when the information becomes stale, right? Maybe a provider might leave one organization or one location and move to other location. How do we manage all that information so that information doesn't become stale? And then, as AB mentioned, that how do we make the entire data ingestion, which is like, for example, rosters coming in, how do we make sure that that roster information is ingested into the plan system, um, within minutes? Not today. I think it takes probably on average weeks to get that information because of heterogeneous structure of the data. So I think AI can play a big role in making sure the data is not stale, the data is rapidly ingested, and then also looking at all different pieces of information for the network managers to make the right decision when they build this network. To answer the question around agentic AI versus traditional AI, um, I strongly believe that um, solutioning is, when you when you build a solution, it's very important to see how do we solve the problem rather than just focusing on fancy technology. Right? So the straight answer is, we have seen you have to use traditional AI or even simple statistics many times can find better insights than complex neural network, right? But then to solve this problem, we have to use the mix of both the agentic AI frameworks as well as traditional AI, and this is how. Um, Today, when we recommend information about a provider, we use an agentic AI framework where our AI agents sort of replicate a subject matter expert in provider data researching about a provider. For example, let's say a provider was working in Boston at Mass General Hospital, and that provider moved to Florida a few months ago. Now, if someone is researching about that doctor, they might seeing that latest research published from that doctor is from that ABC center in Florida. Although a lot of data aggregators are still saying that this provider still works in Boston for Mass General, right? So the agentic AI framework helps in sort of replicating a subject matter expert in finding the right information about the provider, but then traditional AI can help in creating that member profile with that multivariate analysis, as I said before, around the population health management variables such as socioeconomic environment, disease profile, demographic information. So in my mind, it's an ensemble. That's what we call it in data science world, like an ensemble of multiple techniques are required to create a comprehensive solution to solve a problem like this.
Great. Thank you so much, Amit. And we have a question from the audience saying how has High Labs as well as Communicare worked together to really manage the network adequacy calculations as well as understanding network adequacy gaps to all the way to making HSD tables. And so Amit would love for you to discuss specifically on more so one, why is it important to have accurate, complete real-time data for understanding network adequacy gaps and for provider sourcing purposes. And then Amy would love for you to also discuss more so like what has been the experience of looking at a smaller company like High Labs in comparison to where legacy solutions have really failed you.
Yeah, so I think,
go ahead.
yeah, you mentioned real time. I think, thank you for that question, because I think the real time part is important as well. Right? With even in healthcare, when we talk about like claims data or eligibility check transactions, right? If all of that is almost real time, why provider data is behind? And why provider data updates or provider data information should also not be dealt in from on a real time basis? And so that's our mission. That how do we make sure that we constantly monitor all different data sources out there by scanning massive amount of data with lightning speed, and make sure that the right information is available to our customers in near real time. Right? So in my mind, that's the key value add for us when it comes to making sure the network of our customers are adequate with clean and real-time information.
Great. And Amy, how has leveraging High Labs in comparison to legacy solutions really worked in your favor when it comes to looking at providers for gap closure, for example, or doing network adequacy calculations?
Sure. I found that working with High Labs has been much more of a partnership and much more of a collaboration than I've experienced in the past with other legacy groups. And by that, I mean, we have routine meetings where we're discussing our network adequacy, we're discussing what gaps are there, we're discussing what targets are available, where we work together to make some of the decisions and help me make some of the decisions. I've found that that's been a lot, like I said, a lot more collaborative and has really helped us make some growth decisions that we wouldn't have otherwise had the opportunity to do. And just the fact that the information is accurate. With some of the legacy companies that I've worked with, we would find providers that were listed as targets, but they had moved or they had retired or they had died even. That doesn't help. So having the accurate data that's not that I don't have to manually pull, that I can look at any time in the software and figure out what my targets are and be able to rely on that information has made us much more efficient at the health plans.
And I do want to remind everyone here who's attending this webinar that you feel free to ask any questions that, and we're happy to answer them as well, to provide all forms of perspectives from Amy's extensive experience with regards to network adequacy and network management, provider operations, and as well as Amit's experience related to understanding provider data end to end and how AI can really play a role in that. So
The other May I mention one more thing, Tiffany? The other thing is High Labs does the HSD table submissions for us, so they're a backup. Our compliance team can do them, but it's nice to know that we have backup if somebody's out or sick or just on PTO. The other piece is that I don't feel like I'm a small health plan, but I get the same attention as a big health plan. And that's made a significant difference in the way that we've been able to work. So thank you.
And thank you, Amy, for that as well. And one of the things that we want to sort of segue into is that you've mentioned a lot of the times of it's been very important for you to get accurate data and very high quality data, especially when it comes to understanding the expansion opportunities, understanding like what your network looks like. How has it really, I would say, impacted your, for instance, turnaround time in network contracting? How has this impacted your ability to look at network consultants or network managers across the board?
It's made us a lot more efficient. We're targeting the right providers to get the right services for our members. It means that we're not spending a lot of our time and resources because we're a small team. We're a small team and we cover a lot of counties. We have 90 counties that we're active in right now, which is more than almost 4,000 gaps that we have to maintain. It allows them to be much more efficient with their time and focus on where are we going to get essentially the biggest bang for our buck? What's going to close the most gaps? What's going to give the most opportunity for our members? And be able to rely on that information so that we don't have a ghost network, quite frankly. And that's the government's focused on that. They're starting to really crack down on provider data accuracy. They're adding new specialties all the time that we have to track. So it's been very helpful for us. For example, this past year they added outpatient behavioral health. In advance of that, we were able to work with High Labs to see what our network looked like for that specialty and identify targets where we needed to close the gaps. That made it so that I think, if I remember correctly, we only came out with 1 or 2 gaps at the beginning of the year that we still had to close. So that really allowed us to focus on the things that we needed to focus on it, and rather than spin our wheels trying to track down provider information.
Of course, and especially in the advent of I would say CMS really emphasizing the importance of mental health, whether it's, for instance, 2 years ago with clinical social workers, clinical psychologists, as well as now this year with, to your point, the outpatient behavioral health as well. And I think we will continue to see this increase in scrutiny overall. And one of the questions we have from the audience as well is whether or not, Amy, do you contract it with large delegated healthcare systems, and what is your process for consuming their data? And how do you reconcile whether your data is consistently in sync with the healthcare system's rosters? So I think this comes down to, Amy, you can respond as like more so the payer side as well as the provider side. What has been your experience? And then Amit, would love to hear your experiences from the vendor side. What have you seen with regards to ingesting those rosters and the data quality portion to it?
Sure. Yes, we do have contracts with large delegated health systems, and we've delegated credentialing to them. And so we expect at least, we ask for monthly rosters. We also ask for quarterly rosters that is all of their data. So the monthlies are usually their ads, terms, changes, and then quarterly we ask for a full roster. They all send us different formats. Every last one of them sends it differently. And so part of the process and why it's so important that we work with High Labs on it is we will send the rosters, we clean them up a little bit manually, send them over to our TPA for them to consume it. But then the data also gets sent to High Labs and they run it through their AI for the accuracy. And then I can compare the two. I can look at what I have in the TPA system and bump it up next to what High Labs is saying is a red, yellow, green, so to speak. And then we can focus on those reds to kind of keep them cleaned up. So we do it. It's a lot of work because we do have a lot of very large delegated systems like Cleveland Clinic and West Virginia University. But we're making strides in keeping the tabs on whether the rosters are correct based off of the information that High Labs has been able to provide to us.
And how has been your experiences on the provider side?
I'll be honest. I was one of the bigger providers, so I did exactly what the other large health systems do, and I say you're going to get what you get in the format you get it in. So I think from the provider perspective, it's all about revenue cycle. And it was most important to make sure that I had all my information sent to the payers so that I knew my claims were going to process and pay.
And Amit, what has been your...
Sorry, go ahead, Tiffany.
Yeah, and Amit, what has been your experiences when handling these rosters in general?
Yeah, so I would say we take an approach where step one is how do we help our customers, health plans, to move from being reactive to proactive, and then ultimately how do we go from then proactive to real time, right? And you know, these might sound like some buzzword, but let me explain with some examples. Right? So the data can become stale, right? Because the providers might move, the providers might change their organization. So instead of being reactive and wait for providers sending that information, you can be proactive by monitoring all different kind of data sources and fix the data on your own, right? That's the approach in terms of being proactive than reactive. And then when I say real time, that's like when we get these rosters, and again, we're not with Communicare, Amy, we are focusing more on the data quality, but with some of the other health plans, we are also doing all this roster automation work where we are standardizing the rosters, and you have to do that standardization of the rosters in near real time so that you can apply those data quality checks in near real time, right? And then giving that information back to the provider so that you prevent incorrect data to get into your system. So that's the real time part where we are helping health plans to give information at the time of roster automation, and that can happen only when you can convert those heterogeneous format rosters automatically and apply all those data quality checks. So that has been our experience where health plans are able to give real-time feedback to the providers when those rosters are received by the health plans.
Great, thank you. And additionally, one of the things we got to receive a question for is, how do you see AI and ML really shaping network design and provider contracting, as well as like network monitoring? So for example, where have you seen it be applied in like narrow network creation, whether it's leveraging the TIN to org NPI address relationship to determine contract opportunity? Where have you seen AI ML really play a role in this? And we'll start with you, Amy.
It's really allowed us to take a look at what our network looks like, who's seeing what providers are providing the most services to our members, and knowing that what locations they're doing that, bumping that up against the accuracy of what the provider data is, allows us to decide, yes, we're gonna try to steer all of our members to this particular cardiologist in this particular location. Or we can develop a tighter network around who gives us adequacy without having a huge network of providers. Again, that allows us to pick the highest quality providers where our members are seeking services, their preferred network of providers, and really focusing on those.
And Amit, would you mind explain also deep diving into the subject?
Yeah. So I would say we help our customers manage their networks in 3 steps. Step 1 is how do we monitor their existing network, the accuracy of their existing network? How do we help them to get rid of the ghost network within their existing network by making sure there's no stale information? That's step 1. Step 2 is how do we help our customers to enrich their network by giving them by providing them clean provider information of existing provider, new providers. Sometimes a health plan might want to tap a provider who is participating only in one line of business to the other line of business, and then it could be like altogether a new provider or provider group. Right? So that's step 2. That how do we provide that information to our customers to enrich their network. And the third piece is once they have identified the right set of providers, now how can we help them in efficient contract management part, right? And when I'm saying contract management, I'm talking beyond the contract life cycle management solutions, right? Those are great workflow solutions, but then AI can help in scanning through all different type of existing contracts with the health plans, payment patterns within the health plan to make sure that the negotiations are efficiently managed based on the data which is there in the existing contracts and existing claims data and EMR data. So those are the 3 steps or 3 phases in which we help our customers.
Great. Well, this wraps up for our webinar. If anyone has any additional questions, everyone can feel free. High Labs will be attending the AHIP conference in Vegas on Tuesday, June 17th at 3:30 p.m., in which we'll be discussing how to improve provider data accuracy overall. And you'll see our CEO, Amit, who is here as well, be presenting at the conference as well. And I'll hand it over to Joanne and Lisa from AHIP to close off for us.
Thank you. And to our speakers, thank you for that great presentation and for sharing your thoughts. And thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again and enjoy the rest of your day.